When taking blood pressure, make sure your patient has not ingested caffeine or nicotine 30 minutes prior and that they have been allowed to rest 3 to 5 minutes prior to the assessment. Make sure arm is elevated at heart level. Make sure their back is fully supported and their feet are flat on the floor, not crossed, and that the measurement is taken over the bare arm. When placing the cuff, you must first measure the location of the brachial artery just above the elbow. When the location has been acquired, you will place the cuff following the instructions on the cuff. Place cuff tightly around the patient's arm. Make sure your patient has the proper cuff size by ensuring that the cuff covers 80% of the arm. When checking your stethoscope, make sure that the prongs are facing away from you, not towards you. Check that the knob is on by gently tapping on it. Place the knob just below the cuff over the brachial artery. Turn the valve to the right and inflate the cuff to approximately 180 millimeters of mercury or 20 millimeters of mercury above the first quarter cuff sound, which I will explain later. After being pumped, turn the valve to the left and release the pressure at a rate of 2 to 5 millimeters of mercury per second. As you release the air, you will come across the quarter cuff sounds. The first sound will be a loud thump and will indicate systolic pressure. As the thumping continues, it will decrease in noise, and the last noise that you hear will be diastolic pressure. When finished, release all of the air in the cuff and remove the cuff from the patient's arm. Allow him to rest for 3 to 5 minutes prior to the next assessment. After taking the blood pressure, one should compare the patient's values to the values in this chart. Our normal blood pressure would be characterized by systolic blood pressure of less than 120 and a diastolic blood pressure of less than 80. Prehypertension would be characterized by 120 through 139 or a diastolic blood pressure of 80 through 89. High blood pressure stage 1 would be characterized by systolic blood pressure of 140 through 159 or 90 through 99. Stage 2 would have a systolic blood pressure of 160 or higher or 100 or higher for diastolic blood pressure. Lastly, in hypertensive crisis, the systolic blood pressure would be higher than 180 or the diastolic would be higher than 110. In this scenario, emergency care is immediately required.